Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back to your Smarter Heart University.
Newspapers for the blind and hearing impaired. Easy to hear, not just sound bites. All-day webcast news from the world's newspapers, read by live newspapercasters, not computers. Articles may also be downloaded to smartphones and MP3s, soon available by 800 phone. Help is sought by this charity.
Any abnormal cholesterol numbers are considered the primary targets. So, and as such, always have been and always will be. So these features that we talked about, the individual aspects of cholesterol and your waistline and the sugar itself, they are still considered worldwide as secondary targets. But, and I stress this, if we don't correct these features, your risk may be seriously underestimated. And I have strong concerns about this. There is no single drug that can decrease every single metabolic syndrome factor. Their origin really is not related to one single source. Or is it? You heard it here first. Introducing a new way to look at this. It's called SICK, also known as dysfunctional fat syndrome. Okay, so it probably won't take on that significance because nobody wants to be told they have sick fat. And dysfunctional is going to be way too much of a moniker to be able to use. But consider this, class. What if I were to tell you that you could be thin and have sick fat, and you could be overweight and have protective fat? This is what they have found. So again, next time somebody tells you the following, your cholesterol is slightly high, your sugar is a little bit elevated, and you need to lose a few pounds, what are we going to do, folks? We're going to look for all of these factors. You know, now it doesn't matter what your waistline is, and you know how to discuss this with your doctor now. You have the tools. We're giving you the tools to discuss it with your doctor and find out what's your risk for the future. So I find it really fascinating that, you know, now science has allowed this. We didn't know this 80 years ago, but science has allowed this. We know, I'll give you a good example about this dysfunctional fat syndrome. The Asian population, the Pan-Asian community is typically thin, and yet they have the highest level of dysfunctional fat. Their metabolism is completely different than our Western Hemisphere metabolism, such that certain medications had to be given at lower dose. Because they do things differently. So their fat levels, when a lot of times when a patient who has Asian ethnicity comes into my office and we do a cholesterol, it's just so high, and they're petite and they're small. It's amazing. I have a friend of mine who I often tease about all the junk food that he eats all the time, and I just can't imagine, what he's putting in. I don't even want to see his lipid profile for the PVPs we talked about last time. So sick or dysfunctional fat is the way we should think about this. And now all of you out there are smarter heart people. You're educated beyond. You can use these terms and tell your friends, I know something that you don't know. It's looking at metabolic syndrome factors. It's saying, okay, maybe I have dysfunctional fat, but I'm not fat. And maybe I'm a little overweight, but maybe I'm not in that much danger. It's a different way to look at it, right?
It is a different way to look at it. And it's really getting to the heart of what we're trying to get here, right, is that you have to individualize yourself. If you're a little bit overweight, and you get a more detailed analysis with one of these detailed cholesterol analysis, you'll see, my baseline numbers may not be too bad, but when I look at the more detailed stuff, I got a little bit more mud than I should.
Yeah, exactly. The mud and the sand. Our patients come in, I know, I got mud. I walk into the office, for the exam room, and they've had a copy of their blood work, and they go, still muddy. So you're going to yell at me. No, we don't yell. We help. Now, we said there's no wonder pill, but is there a wonder procedure? Briefly, we're going to talk about there's some pretty good evidence that if you have the right mental and physical candidacy, bariatric gastric surgery, either the bypass or the lap band, has been shown to decrease all the metabolic syndrome factors and thereby decrease your cardiovascular risk. I stress this is not for everyone, and after the surgery and the weight loss, if you were at risk before, you need to acknowledge that it never stops. steps so you can prevent getting in trouble again. You're a diabetic always. You're a heart disease patient always. You're a hypertensive patient always. And if you're overweight and you're skinny, you're still overweight. I know that sounds crazy, but and again, this is a helpful tip to keep it in your mindset. If this is something that, if you're out there listening, this is something that you're entertaining. What say you, bariatric surgery?
Well,
we're doing screening for it now.
We are, and we're sending. I have changed the way I thought about bariatric surgery. When I first started my practice, I was not very fond of
Newspapersfortheblind.org.
Big surgery.
Yeah.
Home to the premier narrated news.
We're seeing the data is coming out that shows that the diabetes and the high blood pressure get dramatic, almost disappear, almost independent of the weight loss. They get the surgery and they start losing the weight, and the patients come back even before significant weight loss occurs. That their diabetes is melting away, and we're seeing our patients come in more and more after the surgery, and we're having their diabetes medication, having their blood pressure medications. As the weight is coming off, we're not waiting till the weight comes off before we're having to make these changes. And so something's occurring to this metabolism. And is it because of the surgery, or is it because when you get one of these surgeries, you have to dramatically change the way you eat and what you eat and how you eat in addition?
Yeah, but I say this tongue-in-cheek. We have probably the first time I had a patient that had the surgery, I was astounded by, that she kept on dropping weight. She lost about 100 pounds. It was interesting, and this is why I say you're always a diabetic and a hypertensive, et cetera. Perfect example, and this is a take-home point number 3 today. We kept on halving her medication and decreasing the frequency of her blood pressure pill until she was on none. And she gave it, she was so happy, and she said, I'm off this, and I'm cured. 6 months later, she came back with a headache, and the blood pressure was up. Now, she was very discouraged, but I gave her this point, and I'll give you this point. When you lose the weight, doesn't matter whether it's through surgery or through blood, sweat, and tears, no pain, no gain, whether it is through that, and you will lose, and at least have an option or have a possibility of losing 50% of your blood pressure medications, your diabetic medications, maybe even some of your cholesterol medications when you get into a good program, when you get into a groove and you get into a good therapeutic lifestyle. We didn't use that word. We didn't use that term because people look at that as being a dirty word. But when you get into that type of pattern, whatever it is, you do get the opportunity to stave off taking all the medications. And in this world, with the fact that they're not paying for the medications, and our insurances are cutting our copays down in terms of or increasing the copays, or not allowing us to get the brand names. Nobody wants to take medications. They're afraid of medicines. We tried to do our first lecture on the hope and the hype of heart medications in our societies. You have a great drug, 10 years out. Somebody has to say something and looks back at an analysis and creates an entire chaos about a medication. And you've been on it, and now you're, I don't want to take this. Well, guess what? What's the best way not to take it? Change your life. Change your lifestyle. That's the best way to be able to say, I don't want to take these pills. Nobody does. We all know our risk. We all try to treat our risk, and it's coming to the point where if we don't keep getting the message to our children and get out there in the nutritional programs in the elementary schools and in the high schools. I have got my 3 kids now. I worry about what they eat. So next week, folks, we're going to have some fun. The topic is, I left my heart in Napa Valley, the good and the bad of drinking alcohol and your mortality. This is your Smarter Heart University. Thank you for tuning in. And remember, as always, get to it before it gets to you. Thank you. Have a good week. Stay healthy.
More Dr. Scott and Smarter Heart University is on the way on AM 970, The Apple.